my name's Anmol, and it's great to be here. So Ginger.io, the history is actually, the company is based on the work I did for my PhD thesis a couple of years ago. And it's been a very interesting transition from a research project to now a company that's actually used, a platform that's actually used by all these different institutions and more. So I'll walk you through some of that. So this is something, we've heard this consistently all afternoon, is one of the biggest challenges in healthcare is figuring out how your patients are doing when they're outside the hospital. And the reasons this is all changing is because of the new payment models, the new incentives in the system. And it's something we consistently hear from institutions that are using our system, which is, I have these hundreds of patients or thousands of patients. How do I know how they're doing when they're not inside the clinic, when they're outside? And the reason this is so hard, as you've already heard, is because traditional surveys and other kinds of data don't really scale, right? So it's hard to get people to fill out information. If and when they do, it's sort of not clear if it's always complete or accurate, right? And what would be ideal is if you had, so the sort of circles that represent those clinical visits, you actually had information in between about these patients, so you could act on that information, you could reach out to them if something was changing. And that's where Ginger.io comes in. And so what's interesting about Ginger.io is, so everybody's carrying one of these mobile phones. And turns out your phone is an automated diary of your life. It has a tremendous amount of data about your movements, about your communication style, about how you use your device. About 93% of smartphone users in the US have their phone within 3 feet of them 24 hours a day. And so what we do at Ginger.io, and what's been my background, is working with all the passive data that exists on these devices and building a model of how a person's doing and trying to identify sort of significant changes in the behavior for their chronic condition. What's also interesting about a phone is you don't have to get people to buy a new device. You don't have to get them to charge it. You don't have to ask them to sort of remember to carry it everywhere they're going. With most of the sort of newer physical sensors, physiological sensors, one of the challenges is getting people to use it after the first 2 weeks or after the first month. And this is something that people carry around all the time. So what we do is we work with the calling, the texting, location information, other sensor data that exists on a phone. We can talk to physical sensors if a person has them. And then we passively build models of how they're doing for certain chronic conditions. So here's an example for stress and early onset depression, right? And so DSM-4 talks about how a patient tends to isolate themselves when they have a flare-up of their depression symptoms. And turns out you actually see that in the way they communicate on their phone, in the way they move about. And so both of these graphs, so the one on the left is showing your calling patterns. The one on the right is movement entropy. It's a function of location data collected using GPS or other sensors. And it's showing statistically significant changes between a normal day and a symptomatic day. And this particular study is based on 320,000 hours of data, 3,000 symptom reports. It was nominated for best paper at one of the leading computer science journals. And we have multiple publications of this sort that talk about using passive sensor data from phones to understand a person's health-related behaviors. The key focus for us is mental health, chronic conditions where mental health is a comorbidity, and then we have a long tail of other conditions where we're just sort of exploring the quality of life changes, the behavior changes that are expected according to medical literature. This is a quick sort of overview of how our system works, and I'll walk through all of this in detail, but we essentially have a smartphone app. We support Android and iOS. The user installs this app, it collects raw passive sensor data. We process that data to build measures of how their life is changing. And then we finally collapse all of that into a health status. And that health status can be relayed using many different mechanisms. So it could go to a patient, it could go to a caregiver through different interfaces. It could go to a provider through a dashboard, and I'll show you some of that as well. You know, one of the things I wanted to highlight is typically collecting this sort of is really hard and is really expensive. And with our system, one of the advantages of being almost a SaaS platform is you can get started in minutes. So you don't really have to set up EMR, integration, and all the other stuff. It's literally signing up and getting started and starting to see your patient's data in a few minutes. This is what it looks like on the provider or the nurse side of things. So you have a list of your patients. You can see sort of the red, yellow, green. We call it the check engine light for a person. You can see, you know, how they're doing. You can look at are they filling out questions. If you want to send them questions, you can see if there's an issue with their phone, or maybe they haven't charged their device, or any of that sort. And you can watch all of that. Really easy to invite a patient, press a button, they instantly get a link, they click accept, they install it. When patients install the app, they have to run it only once, so they don't ever actually have to start it again. The only reason they would start it again is if you wanted to ask them questions or if they wanted to come back to the app and look at this information. So there's information related to the person's behavior, there's information related to the rest of the community that they're part of. So typically a community is an institution or a hospital system where other patients have the same condition. And it's similar to some of the quantified self and the other consumer data apps where this information is represented back to the patient. And one of the things the provider or the nurse can do is you can set up the system to automatically send out notifications or ask questions. So you can do things like schedule a weekly survey or maybe a mood questionnaire where something drastic changes. And it's been interesting to see how this has evolved with some of our institutions where we basically replaced a 70-question survey by one question that's sent when there is a dramatic change in a person's behavior related to their symptoms. So it's very fascinating how the passive and active data converge. There's a lot to think about here in terms of privacy and new kinds of data, and we're seeing this across the healthcare system where all these new kinds of data aren't necessarily regulated by the FDA or other institutions. And there's a philosophy that we have from the patient's perspective as a company, which is you as a patient opt in, you have control over how your data is collected, and you have to get value for your data. So it's not just for the provider, it's something for you as well. And then we'll give you a couple of very quick examples. So we're working with about a dozen institutions at this point. We're working with partners. But a couple of examples, this is the one, healthcare. They're the sort of leading hospital network in the Carolinas. And they're using our system in the context of diabetes and patients where mental health is a concern as well. So that's one of our pilots. Another one is in the CHF space with UCSF, so the head of cardiology. This is a 10,000 patient deployment where we're the core platform for the next several years. So just a couple of examples and there are many more. I wanted to flip back, tell you more about us as a company. So we've been around for a couple of years. What you'll notice that's sort of interesting is most of our team sort of is heavily engineering, software. We have people who work in Microsoft. My last two hires are from Google and the person who set up all the data analysis pipelines for EA. So it's a very interesting synergy and opportunity here where we're bringing the best and brightest people from the tech world, and we want to work with providers like you to actually build the systems that can process all of this data. So typically we're processing hundreds of thousands or millions of samples of data per person. So scaling that up and building those machine learning algorithms is a very interesting computer science problem. We've raised a significant amount of financing, backed by some of the biggest names in the VC space and have a strong advisory board as well. Numerous awards, so we've, I think, won about 400, I think right now that figure's closer to 500K in award money, a lot of press, and some amazing partners across these different institutions. So, so that was a quick sort of background about Changer.io. We'd love to find ways to work with some of the people in this room. And I'll be around outside here this afternoon as well, so thank you.